CQC is changing. In this short video, we'll be explaining how each stage of the assessment process will work. Our first step is reviewing evidence to decide which providers to assess next. Our assessments may be responsive, for example, following information of concern, or scheduled. Once that is determined, we then plan for that specific assessment, where our assessors and inspectors decide which quality statements will be reviewed for that provider. We then move on to our gathering evidence stage, using the most appropriate methods to collect evidence based on the set out quality statements. Evidence is gathered on and off site, and there are 6 types of evidence categories that are considered. They are people's experience of health and care services, feedback from staff and leaders, feedback from partners, observation, processes, and outcomes. Each category sets out the types of evidence we use to understand the quality of care being delivered and the performance against each quality statement. This is to make our judgments more transparent and consistent. After reviewing all of the evidence, we'll provide a judgment based on the draft ratings at different levels for the different types of service. As well as using our professional experience and principles to help us determine these ratings, again for consistency we have introduced a scoring framework into our assessments to support this process. Ratings will then be described on the same 4 rating options: outstanding, good, requires improvement, or inadequate. When we assess the evidence, we'll assign a score to the key evidence categories for each quality statement that we're assessing. Ratings will be produced by building up scores from quality statements to an overall rating. This approach makes clear the types of evidence that we have used to reach our decisions. The next step will be a factual accuracy check. This includes asking you to check the factual information we have used to reach our judgment and ratings. This process gives our assessment teams and providers the opportunity to make sure they consider all relevant information that will form the basis of our judgments. Lastly, once the factual accuracy process is over, the final step is to publish the report of our findings. The report will be published on our website rather than a PDF document, so that the information is easier to view on a mobile device and will be more accessible to people using assistive technology. It can also be downloaded as a PDF if you wish. Thank you for listening. If you have any questions on this process, please don't hesitate to reach out to us at providerengagement@cqc.org.uk.